Scott, I guess the first question I would have for you is, when is psychological testing truly necessary? In your view, what clinical questions justify a full battery versus somebody choosing not to do that?
Um, well, I mean, I guess it kind of depends on the issue that folks are kind of getting tested for, and also age ranges. That's a really important variable in all of this as well. I would definitely say for younger kids up to maybe early adolescence, typically where parents reach out to us for testing is for school related challenges. So whether that is challenges with like classes or understanding new material, also like difficulties like bonding with friends, or maybe they're getting left out of birthday parties, or maybe they are recess, the kids that are kind of playing off on their own. Also, a lot of times parents will reach out in regards to like behavior as well, difficulty with like doing a lot of fidgeting in class, or needing to get out of our seats, or other types of things like that. So a lot of times at the younger ages, it tends to be school related situations, but I would also say that it could happen in the community as well, or also at home.
I think that's a good demonstration of what it looks like for kids. I guess
Yeah,
the second part of that question would be, then how does that look differently for adults, and what did they
yeah.
notice?
Okay. Adults are a little bit different. I really run into two groups of adults when we're talking about testing. One group tends to be college age, like younger adults, and still with them, it's often school related, in that there's this transition from home to this next stage, and they have a hard time adjusting for different reasons, whether that's just difficulty with transitioning, or it's the heightened academic rigor of college. um, for older adults, I guess when I say older, I mean like beyond college, right? we I mostly see folks who maybe kind of slipped through the cracks, I guess, when they were younger, and they are maybe self-identifying as neurodivergent, or they are questioning their neurodivergence. And I think that has to do with a lot of different reasons. I mean, I think first and foremost, there was a change in the diagnostic criteria with the DSM-5, which was in 2014, which totally changed how we measure what autism is. The ADHD criteria have generally stayed around the same, but still, like as folks are getting older, and they're starting to notice things in themselves that maybe they hadn't noticed before. So that again could be maybe feeling like they have a low social battery. That could mean having a hard time, getting through a full workday because of the executive functioning demands of the workday. That could mean, difficulty like forming and maintaining relationships. Maybe, finding a romantic partner. So it's varied, but I would say in recent years, as we've gotten into more of this like neurodiversity like movement, we're finding that a lot of people are, looking at online content, TikTok, YouTube, Instagram, and they're noticing like commonalities between themselves and the creators. And they seek out testing often to for that validation piece. For that
And how much of a difference do you feel like it makes? Because it's like, I think that's the other thing. It's like, I think it's easy to judge on its surface and look at like, all right, well, I thought I was ADHD. Now I know that I am. How much of an impact do you feel like that formal diagnosis, as well as the feedback, gives to people? What's most notable to you in that?
Yeah, it's an interesting question. I know, like when I do feedback sessions with my clients, it's interesting because when when they get a diagnosis, I often see tears, but the tears are not of like sadness. It's usually tears of joy because they're like, somebody finally understands me. Somebody finally gets what my experience is like. So both in ADHD and in autism, there's a phenomenon called masking, which is really about like camouflaging traits that, may be in line with whatever that form of neurodivergence is, and people go through great pains to mask, and it carries a toll with it. If you're masking for long periods of time, you're kind of keeping your true authentic self inside. It results in heightened levels of anxiety, depression, all kinds of other types of challenges. And so when they get a formal diagnosis, a lot of times, and not that it's necessary for everybody to get to that point, but it does help to validate their feelings, and it helps them kind of get to that point where they no longer have to mask, because they feel that validity, and they have it in writing, and it just makes a big difference for them.
So I think about that. Sorry to interrupt you on
No,
that.
you're
So
fine.
I think about that throughout the life spectrum of of clients that coming in, from kids having specific accommodations that may be put in place in school and things to be able to help, and recommendations about resources that are specific to different age groups, as well as looking at it throughout kind of the spectrum of life, of whether it be the person that's a mom that has, several kids and recently is diagnosed with ADHD, and you know, recognizing that maybe there's better compensatory strategies and resources for them to be able to handle that, as well as validating like this is something that's really real for them. This just isn't, the process of being a mom. It's actually something that's neurologically different. And looking at those different resources that can help those different clients beyond, like, no doubt there's that cathartic release. So when you say that, it's like I remember a client of mine that absolutely cried in session when that came forward, because they were like, finally, this puts all the pieces of the puzzle together for me. I've suspected this, but it was such a huge relief. To be honest, even me as a therapist, I was surprised at how much it brought forward for them. And they became a real advocate for change in their work environment. It made so many different things make more sense as to why certain things were more challenging. Even though they had read different stuff and had the suspicion, it was just such a big piece that validated it for them. So I guess that's the other piece that I would ask is, like, thinking about the resources and what goes into the feedback session, what are the different things that tend to be most valuable to people in that, for somebody that doesn't even know what that looks like?
Sure. So, I mean, first off, I mean, the feedback sessions are really geared toward explaining like what testing is, and what the various numbers mean. So I give quite a bit of attention to making the reports and gearing the feedback sessions toward whoever it is that's sitting in the room with me. So one thing to kind of let you know about ahead of time too is I will typically release like a draft of the report to the person or family ahead of time, just to give them the opportunity to kind of review it. And because I do tend to use like parent friendly language, I use individual friendly language. I'm not using a lot of professional jargon that's going to be above most people's heads. So I give them the opportunity to read it, so then they can come in with any questions or anything that they need follow up on during the meeting, so I can make sure that we're covering those types of things. But I do go through like, what does the testing mean? What do the different numbers mean? We go through the diagnostic portion and kind of why the various testing measures and performance led to the diagnosis or diagnoses that are in the report. And then the vast majority of the feedback sessions are really geared toward recommendations, and they can vary across the board. I mean, there's so many different things. So a lot of times I'll recommend make recommendations for professional support, so whether that's therapy or whether that's maybe seeking a medical provider or a dietitian, just to take care of various areas of need depending on the client. I also make formalized recommendations for accommodations as well, which is one part I did mention before, but I think it's important, is that when parents or families or individuals need formalized accommodations for work or for school, self-identification is usually not enough for that. They need formal like documentation for that. And so when the assessment is finished, and we have all of these testing data, I want it to be in a form where parents can take it right into the school and show it to the ARD team or to the special education staff, and or the student support team, and let them know that that my son or daughter has a clinical diagnosis, and these are the accommodations that are recommended. And more often than not, they get it adopted because of of how thorough the assessments are. Similarly, for the workplace, if I have, a client in front of me that is diagnosed on the spectrum, they may need access to an environment where all of their senses are not pinging all at the same time, right? So they may need a quieter environment. They may need, access to special materials or special lighting just to keep them from that sensory overwhelm through the day. They may need a specific schedule structure, or they may need a schedule that's going to decrease the number of transitions through the day. They may require, special or direct feedback from their supervisors or colleagues, to kind of help them adjust, their social or communication style according to the workplace, but also give them an opportunity to advocate for themselves, so they can really have that opportunity to say what they need. So all those types of accommodations are really important. And you can't typically get those with self-identification. So that's why, a formalized assessment's also important, and also why, I cover them so much in the feedback session. I also cover recommendations for home structure and lifestyle changes. For example, for a client that has ADHD, I might suggest, if you're working from home, like having a separate, like, living and workspace. Maybe even sometimes like taking a break and taking a walk outside in between the two. So you're having a natural transition between like home and work, as opposed to just expecting to open the door and then we've completely gone from one setting to another. We talk about like circadian rhythms. We talk a little bit about like, our sleep wake cycle, and, what times of the day we're most productive. I mean, that's another area in which it's important that we're knowledgeable about as we are kind of going through our workday, so we know when best to schedule our high effort, high intensity types of tasks. I also, make recommendations around social structure as well. So, for example, for folks that are diagnosed on the spectrum, I might recommend community groups, sometimes therapy groups, definitely interest-based, socialization. Improv comes up a lot for that.
Improv, D&D. What are the other things that you recommend in that same vein?
Yeah, exactly. And I also make recommendations about like how to advocate for ourselves and how to pull people in, to help us. I think one important thing, I always say to the folks that I see, whether for therapy or for assessment, is independence is not about like doing everything on your own. Independence is about being able to pull in the right resources to help you when you need it.
Yeah, I think that's smart, just because I don't know, I kind of view it as there's different kind of operating systems that exist for all of us. And so part of it is trying to figure out those different things that encourage kind of maximal interoperability for us, and knowing that like that is unique to the user, and that's important to try and figure out kind of the ways to adapt the programming to the environment. So, because I can say in my own practice, having worked with different clients, whether it be with ADHD or autism, it's so important to take in their feedback and their unique circumstances and look at those things to adapt. And like I had a client of mine talk about like, being on the spectrum, for instance, and how having an interview and then having a location suddenly change, or people who were interviewing her suddenly change. That was something that was really jarring to them, kind of almost like going into a room that you were expecting to have on, like lamps, and the overhead lights are on and there's a spotlight on you. It just felt entirely different in their experience. And so it's important to kind of be aware of those differences. So I guess the next question that I'll ask you, Scott, is what separates high quality psychological testing from testing light, or maybe somebody going through and getting it done with insurance? Just because inevitably there's a big difference between those two different things.
Yeah, I mean, so it's a tricky question, because I think there's some variability among all the different types of testing. I can say like what makes our testing distinct, which is important. So first off, I mean, I would say that we take a neuroaffirming view to testing or an assessment. And basically what that means is, there's multiple models of like autism and like neurodivergence that are coming more to the forefront now. So there's the medical model, which is purely based off of the DSM or our like manual for diagnoses. That's the system we've been using for years. And then more recently, they're starting to develop a little bit more of like a social model, which is a model that more like autistic self advocates are kind of like adhering to. It's more about like, autism as like an identity. Autism is like a form of neurodivergence that's completely within the norm, as opposed to it being about like this either a medical condition or this thing that is completely, for lack of a better word, like bad or harmful. So when we take a neuroaffirming stance to testing, we're really emphasizing strengths. We're emphasizing positives in the individual. We're emphasizing like how, certain tendencies, traits, qualities are adaptive. So with a thorough assessment, it's going to take, there's going to be multiple parts to that. One part is the clinical interview where, we kind of dive into everything. We talk about development, childhood, education. We talk about any ongoing medical issues because those can have a bearing on a diagnosis. We talk about mental health. We talk about communication, socialization, behavior, talk about vocational skills. We get a thorough background and history. And then I do one-on-one testing and our testing for neurodivergence. I would use a cognitive test for just to get a basic IQ level, just to kind of get a sense of like what are the individual's like strengths and challenges in terms of like various areas of like cognitive skills, executive functioning. And then we also do lots of questionnaires. So there's questionnaires for executive functioning, there's questionnaires for social skills, questionnaires for mental health and personality. And those are completed not only by the individual, but I ask them to submit multiple other raters to kind of help get an idea of where are we seeing certain traits and qualities and where are maybe some of those things being masked.
So that's the like collateral information from like parents or partners or schools or supervisors, that kind of stuff.
Absolutely. Yeah. So that's a critical piece of this as well. And then whatever the area of neurodivergence we're talking about, I also use interviews that are geared specifically toward those. So for ADHD, I use what's called the executive skills questionnaire, which is meant to be a questionnaire, but I flesh it out as an interview. And I'll usually do that with the individual and maybe somebody that they know really well. So they're each rating the individual on, say, response inhibition or impulse control, or maybe working memory or sustained attention. And we'll talk about like what the different people's ratings are and maybe a little bit about why they're different. So we're really diving in into each of those areas to really see where are their strengths in executive functioning and where are the areas in which maybe they need a little boost or they need a little bit of support. For autism, I use an interview measure called the MIGDAS-2, which is really seen as more of a neuroaffirming measure. And it's really getting in deep about each individual's like specific, traits. So we might talk about sensory sensitivities. We might talk about sensory overwhelm. We might talk about sensory interests. We'll talk about how we handle transitions or how do we handle the unexpected. We might talk about, stimming or, fidgeting. We might talk about relationships, social skills, social interactions. And then we also talk about communication as well. And it really dives in deep into each area. So I can really get a sense of what's this person's like individual experience like. So there is a measure that's considered to be kind of the gold measure or the gold standard for autism. called the ADOS, which is really an observation-based measure. And I have used it before, and I still do use it for younger kiddos because they don't have necessarily the same communication skills to kind of be able to like talk about like their day-to-day existence that adults have, or the day-to-day experience. But what I find for teens and adults is they're really have a lot to say about, you know, what they're experiencing, what their life is like. And I find the MIGDAS too, because it is more of an interview measure than a direct observation measure. I find that it is one in which I can really get a sense of like what what is really going on for this person, and it really does help me to kind of it helps to remove the mask. You know, when we're able to kind of talk about these things directly, and so that's that's one of the things that I think does set us apart, is that we do use more neuroaffirming measures than say what an insurance-based evaluator might use.
Yeah. Well, thank you, Scott. I feel like all of that's really helpful. I guess the last question that I would ask in this is, do people ever find, like, let's say somebody's going and getting testing done before they've been put on medication. Do people ever come back and then get testing after they've been put on medication just to see how they perform on specific batteries or things like that?
That's a good question. I have not encountered that at Just Mine so far, so I'll just say that. Just because like testing is, you know, there is a cost to it, right? Like there's a monetary cost, there's a time related cost, and I guess generally like people don't seek out testing when they are doing really well with something. So if they're having a really positive, you know, experience on medication, chances are they're probably just going out and living their lives and are, you know, just doing their thing, you know? So yeah, I will say, I'll add a caveat to that. Like if somebody is currently using medication before they come into testing, I still request that they stay on the medication throughout testing. I want to get a sense of like how they're functioning right now. And so like if we remove medication and try to set up a situation where like maybe certain behaviors or certain traits come out, I don't feel like that's very fair for the client, because I don't feel like I'm really getting a sense of like who they, you know, who they have been, you know, or who they really are without that medication.
Personally, I think that would be an interesting thing if we like can do that in the future, just because I think it would be interesting to see like the baseline and then like how it is potentially at different medication thresholds too.